Yeah, this is the second video now. They always say, we start a YouTube channel or podcast, you look back on your earlier work and you go, oh, that was horrible. And I just really want the content to be good. So any comments, any improvements you want, paininformation.com. The podcast is Pain Information. And I'm open to virtually any topic that distresses you in pain, function, quality of life, depression, anxiety, and addiction. I'm also boarded in addictionology from a couple of entities, and I think we're going to be getting into those weeds pretty deep, but not right now. Right now we're going to talk about invisible pain. That's one of the rules from the first one of our YouTubes is pain is a description, it's not an entity. That's rule one, right? Rule one. Rule three, if you don't believe in it, you think it's entirely psychosomatic, you got to refer it out. But rule two is you got to have a diagnosis. Well, how can you get a diagnosis if you can't see, touch, feel, or measure pain? Heard that before. You can hear it a lot. Because that's what pain is. It's a personal experience. It has to do with the central nervous system. Has a lot to do with inside out as opposed to outside in. Folks think of pain as bone broke, bone hurt. True. But what about that abdominal pain? It doesn't have any characteristics that are very definitive. You stick your finger on a pin, it's right there. You put your hand on a hot plate, right there. Abdominal pain, crampy, aching. When you start getting into pains that are really hard to characterize, the fibromyalgia pain, the interstitial cystitis, yeah, bladder hurts, yeah, muscle hurts, but is it really a bladder problem or a muscle problem? Might be. We can get deeper into that with fibromyalgia, but reality is this. Fibromyalgia really doesn't have a test. There are some people out there that say they have this test that looks at certain markers. These are inflammatory markers, and yeah, it's expensive. And they look at genetic markers and they believe there's a, quote, vaccine that's possible for fibromyalgia. Well, I don't know everything, but I'm a wait and see guy. Let's see the science. But I do believe in a few other things that are invisible. And that's the central nervous system pain inside out, not outside in. Because what you really can't see, touch, feel, or measure are so many of the common pain complaints we have. Look at headaches. Well, everybody believes in headaches because usually everybody's had one. People don't believe in fibromyalgia because they don't understand what fibromyalgia is. Interstitial cystitis, chronic fatigue, irritable bowel, the fibro 5, right, with migraine. So what's going on here? The newer stuff, neurobiologically and newer science, is glial cells. These are support cells for the central nervous system, the neurons everybody seems to know about. And their activation and the process of neuroinflammation is really coming to the forefront of understanding what pain is all about, what chronic pain is all about, because chronic pain happens acutely and acute pain happens chronically. Got that? So there's a very gray distinction between the two. In fact, studies have now shown with a high level of confidence, you can believe it, that you can almost tell with a very high level of confidence who's going to have chronic pain from the time of injury, low back pain. And you do that through functional magnetic resonance imaging, fMRI, and there's a footprint there. You also see that footprint with fibromyalgia. You also see that footprint with other types of pain, actually in the brain. There are neurological changes. What does all that mean? Well, it means that the central nervous system is actively involved in what you feel. So don't discount the central nervous system inside out. as opposed to outside in. It's a muscle pain, right? It's a muscle pain, fibromyalgia. Not necessarily. There are some biomarkers that looks like the muscles may have a neurohormonal effect. But traditionally, we can't put nerve conduction studies into the muscle or do a muscle biopsy and see anything. You just can't do it. It's just not there. So what gets discounted? Rule 2, the diagnosis. You can't see, touch, feel, or measure. You got to believe in something you can't put a diagnosis on. You don't have a test for, and what happens? Most folks, and I'm talking across the board, from family and friends all the way to healthcare providers, don't necessarily believe in fibromyalgia or believe in the invisible pain. This is step 1 in that process of walking that journey, understanding pain. And I did a partial series on understanding pain in pain information during the podcast, and also pain for older folks, some of the newer stuff, because it's a personal experience. It has to do with age, it has to do with genetics, it has to do with what you are. Your personal experiences, yeah, that all plays into it. But the reality is, sometimes through processes that we're going to talk through, this process of neuroinflammation is a big part of treating you. And we treat you with Rule 4, those medications. What is Rule 4? Well, it's 5 meds, 5 categories, and one of my categories is gabapentinoids. The gabapentin, which is Neurontin, brand name, Lyrica, which is pregabalin, generic name. Those sort of things work in the central nervous system, inside out. It all starts to come together. We'll get to talks about ketamine, low-dose naltrexone, and other things that help a lot. In fact, checks a lot of boxes for fibromyalgia. We get into those agents. Naltrexone fills a lot of those buckets. So, okay, a good start. And we're going to continue this talk. I will continue the invisible pain in our next YouTube, and that'll be number 3. So we're going to continue this with the understanding that it's one step at a time, but they add up. And it's not to overwhelm, it's to give information. Not earth-shattering information, but real information. I don't want people to watch this YouTube channel and think that they're wasting their time. I think that that's an abject failure on my part. So information and feedback, good. But I really like it constructive. If I'm not doing something right, let me know that too. But the reality of it is, it's participation. When we get into the painful journey, it's a participation in you, your healthcare provider, the folks around you, and understanding that pain it's a difficult thing to understand for everybody. Pretty good place to stop, and we'll pick it up again soon.